All right, here we are, Greg.
Hey, how you doing, Rick?
Good. Welcome back. Here we are at Healthy Hour After. We want to talk about some great info today.
Yeah.
And it emphasizes, we usually start an episode with essentially a medical disclaimer. We are medical providers. We are not your medical provider. What we provide here is information and education. And we really just want good information out there for people to use. But it is not meant to replace your relationship and advice of your professional medical provider. So please consult with them before starting any medical weight loss program, any supplements, any medications. And that's super important today, because what we really want to talk about is some options. We've talked a lot about different, lifestyle changes and things. We talked last weeks about GLP1 medications and what a life-changing whole paradigm shift they are in the weight loss thing. They really are shifting what weight loss means.
Yeah. And even other things, right? We talked about other benefits of GLP1s. It's the weight loss stuff, but it's so many other things. Right. And so we expect that'll continue. We'll talk about GLP1s ongoing here, probably forevermore.
Yeah.
So
yeah. But then again, they may not be for everybody. They're expensive. There's some downsides, and we want to be honest about that as well. And there are some other options. So what we really want to talk about today, I think, is some different options, review a little physiology, and talk about maybe some other options that aren't GLP-1s.
Absolutely.
But the important thing is a lot of what we're going to talk about, there are prescription medications that require your provider, your medical provider, to prescribe medication. And inherent in that is a responsibility to oversee your use of those things and how you're responding to those, and make any dose adjustments. And so we'll talk about that, but it's just, I can't emphasize it more, the importance of doing this with your medical provider, because that's really what we're going to talk about is things that require that.
Absolutely. Yeah. And we can always talk about support and things you can do on your own. We're gonna kind of dive into this more, but just having the support of a medical provider is shown study after study. Every time they've studied and looked at this, having that accountability as well as the support from a medical team, it really does and can enhance the benefit, namely really just the overall outcome. Like your outcomes are better when you have a medical provider that you can do this with, that you can seek medical attention from. If needs be, you can discuss the good, the bad, and they can guide you through this process. So we're going to talk about a lot of that today.
Awesome. So let's get into it a little bit. So GLP-1s, I mentioned they may not be for everybody. There are some downsides. There are some things, some people have side effects that they just cannot manage. They just can't tolerate the side effects. Usually that's nausea. And there are people, I know people that really cannot tolerate more than like the tiniest little dose, and it messes them up.
Yeah, it's like a dose that is going to be not probably effective for them in terms of weight loss, maybe a really low dose, but gives them all the side effects. Unfortunately, there are a few patients that Rick and myself have seen that, a lot of people tolerate them fine. And the worry of a lot of patients I see is the side effects. Most people really do tolerate them fine, but there are some patients that for one reason or another, whether it be, the side effects or whether it be even the cost of the medication itself, is that they just, for whatever reason, they can't be on them. So we want to discuss some of that today, some alternative options that are, you can discuss with your medical provider.
Yeah. And there are a few people there, there are certain medical conditions that are contraindications to taking it. I mean, if you have, if you're one of those people that has a family history of multiple endocrine neoplasia type 2.
Men's 2. I call it men's 2 because I can't say that big word.
I mean, that's a real thing. And you should not take GLP-1s if that's you.
Sure.
So there are other options. And then there are people who just cannot get over an injection.
Yeah.
It's just, and that's okay.
It's true. And there are oral forms. And we talked a little bit with Cliff about that. If you guys ever tuned into that episode about oral peptides, GLP-1 specifically. And we know that the absorption is significantly lower, but can be effective for those that don't essentially or can't tolerate injections. The problem being there, once again, is sometimes there's some barriers with oftentimes the oral medications that have the side effects that are undesired. The absorption is not as good as the injections. And then once again, cost. Cost is sometimes one of the biggest barriers.
Yeah. So the big picture on weight loss physiology, let's just do a little refresher. We've talked about this a little bit more in detail in some episodes about what we're talking about with weight loss. We're looking at regulating appetite, and that involves some things in the brain and some things that are hormonal. We talked about insulin a lot, and how that guides your body to store fat. We talked about energy balance and hormonal drivers.
Yep.
We talked about just the willpower and how often, willpower just isn't a thing on its own. Like you wish it was, but willpower alone doesn't seem to be as effective as willpower with assistance.
Yeah. And a lot of times on that willpower, boy, it can short term.
It's short term.
Right?
It works short term, but it is rarely sustainable for long-term lifestyle changes.
Right.
Yeah.
That's what the science and the evidence shows. That's what over and over again. And it's because you're constantly fighting the system that is meant to keep you alive. Your body wants your appetite to be high because it thinks that you're hunting and gathering for food. Your body doesn't realize it's 2026 and you're not in a position where you have to go and do that.
Right.
And so there's a reason why our body does that. It's frustrating at times when you're in a position where you're like, hey, why do I feel hungry all the time? And then of course, the way that we live and our lifestyle sometimes just even feeds that more, right? We've talked about the insulin, which we really dove into recently, about how once that gets going in the wrong direction, it just feeds the cycle of constantly feeling like you can't ever scratch that itch. And you constantly feel hungry because we know it increases other hormones, including the hunger hormone. And it's this vicious cycle.
Yeah. Okay. So what we're going to talk about, several medications at this point, all of them target some of the pathways that we talked about, like how your body handles the hormones, the energy levels. So let's dive in with number one, Phentermine. Phentermine is a medication. It's a stimulant.
Stimulant medication. So it is a controlled substance. By a controlled substance, we just mean that it does require a prescription. And when it's controlled, it does mean that there can be a dependency or inclination for, like, you can basically build up a physical dependence on that medication. And so it's controlled for a reason, right? You need to have this monitored by a medical provider. This requires a prescription. Phentermine, besides the GLP-1s, by far and away, before the GLP-1s even, there was Phentermine. Phentermine was by far and away the number one weight loss medication that was prescribed. And so it's important to know that kind of what it does. The good news about Phentermine is it's inexpensive. It's not costly. It's maybe $20 for a month's supply at the pharmacy. And so it's a really effective medication. It's a stimulant medication. So it hits on some pathways that suppress appetite, that suppress cravings and hunger, oftentimes gives you energy. A lot of people really love the little boost that they get from Phentermine. And I'm not trying to, target any one specific group here, but moms that are, maybe just like that kind of post-pregnancy, post-breastfeeding, trying to get off the baby weight, but also feel like your energy's zapped because you're just taking care of babies and doing all the things that moms do. Like I said, I know dads do some of that stuff too, but I'm just saying, like, that's one where Phentermine I find is so effective. They get that nice boost of energy. They get a nice help with appetite and cravings. You usually take it in the morning because it's a stimulant, right? You don't want to mess with your sleep, as we've talked about before. And so they take it in the morning, the AM hours, it lasts 8 to 12 hours. And you just get some good energy with some appetite and craving suppression, and usually is meant for more short-term use. Recent studies have come out. They actually, the American Obesity Association, as well as the American Endocrinology Association, released, and don't quote me on this exactly. I'm not reading off of anything to be able to say this, but essentially released a joint article, a shared article, where they really found that, like, the use of Phentermine is really per patient. It used to be a set, like 3 months, no longer. Now they're finding that, like, hey, look, if these people are reducing their risk factors, their weight's dropping, they're tolerating it well, there's a very low risk for dependency. And if they're doing well on it and losing weight, they're actually risk versus benefit ratio goes up. If they need to be on it longer, it's totally appropriate. Now that's of course where the medical provider then
right.
comes in.
And you make a decision based on
Yeah.
that as a provider.
So, super popular medication.
So by short term usually has meant 3 months, but now it looks like evidence suggests that could even go longer than that.
Yeah. And they didn't do a whole new study on this. I mean, that those are very costly, millions of dollars to do these studies. Phentermine's been generic for quite a while. They more so were looking at it from the endocrinology, association, as well as the obesity association. Like these are professional bodies of medical providers that are trying to just give you the latest, greatest information. And so they're not like, they don't have stock in Phentermine or anything like that.
Right.
They are really just looking to update and provide quality information.
Yeah. And good usage data for providers.
Yeah, guidelines.
Okay, so what are the downsides on Phentermine? Why would I not take it?
So it's a good question. So obviously, if you have a concern with taking anything that's a stimulant, if someone's ever had an addiction in the past to stimulants, whether it be legal or illegal drugs, definitely don't want to go down that road. You don't want to start that pathway again. If you are very sensitive to stimulant medications, you could sometimes just do a lower dose. Phentermine has a pretty broad range where it works within. So I have some people that are just sensitive to stimulants. They tried Phentermine and did really well with it, just at a lower dose. But in some of those people, insomnia can be one of the side effects that I'll see. Now, most people typically 3 to 5 days of maybe feeling like they didn't get as good as sleep, and then they get kind of used to the medication. They start sleeping fine. But I've had a few patients that just really couldn't tolerate that. They would be able to get to sleep and then they'd wake up for no apparent reason and just couldn't get back to sleep. And that's just, of course, we've talked about it a bunch here, how important that is. So we don't want to have, who cares if you have some decent energy during the day and some appetite suppression if you're not sleeping, because eventually that will just wear you down. And we know that can have a counter effect to your weight loss.
And then additionally, as a stimulant, it affects your heart rate and your blood pressure.
Absolutely. So you can have palpitations, you can have, this is age dependent. There's not necessarily a definite cutoff in age, but I'm typically not putting grandma on this. No offense. I know that grandmas are now younger. It seems like younger nowadays, 40-year-old grandmas. So
great grandmas.
Great grandmas.
We're not putting great grandmas.
Really anyone over the age of 60, extreme caution with this, right? We don't need to be working that ticker necessarily harder than you would with normal activity and exercise. Number one side effect I actually see on this medication is dry mouth. It has a little bit of an anticholinergic effect. And it'll dry your mouth out a little bit. So we do have to be cautious of that. I love that side effect for patients because it gets them drinking water. And so I personally, when they tell me they have a dry mouth, I'm like, perfect, drink more water. And this will help. So constipation.
Use it as a tool.
Yeah. With that dry mouth, you can get some, of course, further down the GI tract, you can get some constipation. Not something that I hear a lot. If people are drinking water and they're moving more.
If your mouth is too dry for too long, the other end will be too dry soon enough.
Yep. It's all connected, right? It's all connected. So Phentermine's a great one. It actually, besides the GLP1s, has been found to be the most effective percentage-wise when they did the studies. And I want to say it's right around 8 to 10% is on average what people lose.
Yeah, I think that's about right.
And so 8 to 10%,
that's
which is really good.
Yeah, that's good.
And it was really the most effective one until the GLP-1s came out, really the most effective way. And once again, it's pretty cheap. It's generic.
This is old school weight loss.
Yep. $15-20.
But still widely used.
Yep.
Yeah. Okay. So I'm still stuck on the GI tract. Like what's our little catchy phrase we can say? Like when it comes to your GI tract, you need to stay wet the whole way through.
Yep. I don't know. Wet might be
constipation is not a side effect. We might do a whole
constipation
episode.
Starts at the mouth. Yeah, we're gonna have to work on that.
Do an entire episode on constipation. It actually is one of the biggest side effects of some of these medications as well. All right, so Phentermine, that's awesome. So now, let's just stay on that for a second. There's actually a combination product, right? With Phentermine and Topiramate.
You can do a combo, which is called Qsymia or Qsymia. That one's, the pronunciation might be a little bit off, but it's Qsymia is a combination of Phentermine and Topiramate. So Topiramate, known drug used for actually seizures. It's actually for the brain.
And some people use it for migraine headaches, actually.
You got it. So headache medication, seizure medication. And so it actually works really great at low doses for appetite suppression.
So this is working on that part we talked about, part of the brain, the dopamine section. Okay, go ahead.
And so it's just really nice. We oftentimes, if I have patients, so I use this in a couple different ways in clinic. Oftentimes it's in addition to, so the phentermine's not quite getting you there. You want the combination, or you are sensitive to stimulants and you like the phentermine at a lower dose, but then you combine it with the topiramate. Okay. Really effective that way. The other thing that topiramate works really well for when I'm seeing patients in clinic, if they are like the phentermine's wearing off around 6 or 7 o'clock in the evening, and I need something to bridge me because I get really snacky between that 7 and bedtime. And we always talk about not eating late. And so sometimes if I do it separately, not the phentermine topiramate together, I'll do phentermine for the AM hours. It wears off in around late afternoon to early evening. Do a topiramate just on its low dose, and it'll bridge you in without that stimulant effect. Topiramate, unlike phentermine, still helps with appetite and cravings without the stimulant effect. It sounds counterproductive. Some of the side effects of topiramate are, making you tired. I don't see that as much. Every once in a while, I'll have patients that get a little bit dizzy. But once again, at these lower doses, I just don't see the side effects all that often. Most people tolerate it fine. If I take a patient off topiramate, it's generally speaking because they just don't feel like it's working well enough to get them where they need to be. And we sometimes have to go a different route. But for the patients it works for, it's a great combination with or without phentermine.
Okay, awesome. So the topiramate, what it adds to the phentermine as a stimulant, works on an energy level, is the topiramate would be kind of working the brain on your cravings, on that reward pathway that leads you to emotional eating.
Sure.
The person who's like, I don't feel physically hungry, but I keep eating anyway.
Yeah.
That's what we're targeting with this.
And it really does target different pathways, as Rick was saying. So I like it because sometimes we need a little bit of a combination approach there. I find that it's very effective. I'll typically prescribe it separately. I don't usually do the name brand because it's a little more expensive. So I'll typically prescribe it phentermine and topiramate separately and just figure out what combo works for the patient. It's generally, once again, the real reason why you want to go to a medical provider that deals with specifically with this is because they can usually find what's going to work best for you.
And it makes sense, when we talk about like how that works on the brain, because it's actually used sometimes in helping with smoking cessation, right?
Yeah.
So it's just that whole kind of reward pathway in your brain that we try to interrupt. So that's good.
It's good. And if you're smoking and it stops you from craving cigarettes, I mean, I think
it helps you quit smoking. It's all the better thing. Like smoking still 2026. Here we are. We will say right now, smoking is still bad.
Yeah. That hasn't changed. There's no new data in that. In fact, there's more data against it than ever before. So
I mean, this is okay. Side note, but in like practice in the emergency department, that to me, it's one of the most heartbreaking things is to see people who we see people at the end of years of smoking and they all know, everybody knows you're not supposed to smoke, but when that day comes that like, I can't really help you breathe anymore, you're never going to get better. Like to me, that's a sad day.
Sad.
And I think all these things they're addictive, it's really what we're trying to do is get people to be able to make these changes, improve your lifestyle, because improving your lifestyle improves your life. And it's not just about extending how long, but it makes your life better.
Yeah. So, I've heard kind of the argument with smoking is that like, oh, well, it really helps like suppress my appetite. And I'm like, boy, we got to find something else.
That's not at all a healthy way to suppress your appetite.
No, I mean,
the side effects are ultimately way worse.
Way worse.
Anyway, all right. So now let's talk about. Should we talk about Orlistat?
Orlistat.
So this is Orlistat is a medicine. It's a fat absorption blocker. Like you eat it, it doesn't get absorbed in your body.
Yeah.
Right. You take it and it stays in your intestinal tract. And in the intestinal tract, it grabs onto any fat you eat and keeps it there. That's kind of how it works, right?
You don't personally absorb fat. Now, this Orlistat got popular, especially during the 80s, 90s, when fat was looked at it like
That's
the big enemy.
Yeah.
Which we look, too much fat, we can argue like, yeah, that's not going to be good for you. But we also know fat's not the enemy, like the biggest enemy. At the time, it was really, and still is, more like sugar, simple carbohydrates. But this came along when it was like, hey, fat's the enemy. So if we just stop you from absorbing fat,
you make your body so you cannot use it. You can't get it in you.
If you're not like a sweets person, but like you overdo it on all the fatty stuff, then this might be a good option for you. The only side effect, which I mean, kind of is intentional, is that if you overdo it on the fats, you will know it.
You will know.
Because it does not absorb. So it has to leave the body. And you will have some bowel movements that will be like, you will have to put in your diary. Because it'll be something for the record books.
I never realized that diary sounds like the very start of diarrhea.
It'll be, I didn't, no pun intended there.
Yeah, but that's what you're going to get. Like straight up, you eat Orlistat. It keeps you from absorbing fat. And that's good because fat is very concentrated calories that your body can store as more fat. I mean, so it's a reasonable thing, but the fat stays in the pipe, and
you don't absorb it.
It keeps going through until it leaves the pipe.
So if you overdo it on fats on this is kind of just more almost like, hey, we're not going to absorb as much fats, and you need some fats, right? So it's not to stop.
So instead of going into your body and being used, it goes into the toilet.
Yes, it goes into, it stays in the
your
GI
pants.
Yes,
or
wherever,
wherever you are, and then it has to come out.
It's not going to absorb.
It doesn't go anywhere else but out.
So this has been really popular. It is prescription at the higher doses. It's actually
low dose over the counter.
Yes, a low dose over the counter. So it's not a bad option if you feel like the fatty stuff, like even like I would say the ice cream is probably dual, right? It's like the high fat, the high sugar. So I really think that it comes down to, this is an over the counter and or work with your medical provider. We're going to tell you why we believe working with your medical provider is a better option here soon. But either way, this one is about 3 to 4% drop in body weight. So it's about half or a little less than half of as effective as, like, say, something like a comparable Phentermine. And so not crazy effective. But if it discourages you from overeating on the fats, that's really where I think the biggest benefit is that sometimes we'll put you in check and be like, I know if I overdo it on the fried foods or the too much ice cream, I know I'm going to pay for it.
It literally provides a motivation for you to be cautious about your fat intake.
And all the side effects are related to GI. I mean, there's almost
that's all that stays in there. Yeah. Awesome.
So.
Okay. So those are some things to talk about. We got a few minutes. Let's talk about some off-label uses of some medications. And by off-label, we've talked about this before. That's just using a provider prescribing a medication that hasn't really been studied for this, but it's kind of known that it helps with something, right?
You're kind of banking on the side effects of a medication. You're knowing that, like in our case, usually hitting on either something that helps with metabolic support or control, or something that really helps with what we know is, like, as a side effect, hey, everyone that was put on this medication reported 80% of these people reported that it decreased appetite and cravings. Well, so they didn't study it for that, but they had a significant amount of side effects of, hey, these people tend to lose weight because their appetite decreases, which is when we talked to Cliff, if you guys remember, I mean, which is kind of how GLP1s were found to be more of a weight loss as opposed to just for diabetes. So it's I think one of the biggest ones that I use in clinic still to this day is metformin.
Which is, again, it's a diabetes drug. But it supports weight loss biology. Right.
So improving insulin sensitivity is the biggest thing, and we talked at length. Was it last episode that we talked about insulin a lot? I sometimes get them. One of the episodes recently. So you have to go, see that is we talked about the importance of insulin in your body, how insulin uses everything.
I think it was last.
Store. We ended up, it was last one. Your insulin, improving your insulin sensitivity just means that your body is more sensitive. Your body responds quicker, more timely insulin release. So when we have that with something like metformin, which is an oral medication, so that's why a lot of people like it. A lot of times it just helps your body really just utilize the metabolic system a little better, and utilize insulin a little bit better. So keeping blood sugars in check. So insulin resistance or insulin, increase in insulin sensitivity, it can really help with that. Now, there's been a couple studies that have shown there is no direct effect on appetite or cravings with metformin. There's never been anything shown with that in terms of when they studied this medication. However, there's been some studies that have found later on that when you get your metabolic system in check, you're not doing this big yo-yo up and down with your insulin and sugars, is that there's an indirect effect of better management of cravings. So not necessarily appetite, but cravings, right? Because what drives cravings in a lot of cases, we had a bunch of sugar earlier in the day. Now we've tanked our blood sugars and now we're looking for anything sweet. If you can get that under better control and get less of that yo-yo, metformin essentially can help with some of those cravings. So I do like it. I've had patients that reported back after putting them on it kind of unexpectedly that they're like, hey, yeah, it's helping me lose weight, helping support my metabolic system. I feel like it helps me be, the word I hear all the time is more steady, just more steady in my blood sugars. And then an indirect effect of like, and it just helps me with those little afternoon snacky, I want a sweet cravings. It just helps kind of calm that down.
Yeah. Awesome. Okay, so those are, I think that's a good list of some options that people have outside the GLP-1 realm. But again, these things that we've been talking about require a medical provider. Now, let's talk about a supplement of the week.
Yeah,
that you could actually get without your medical provider, right?
So
anything in this realm.
Yeah, supplement of the week we want to talk about is berberine, and it's because it's a supplement. You don't need a prescription for it. It acts very similar to metformin. In several studies, it shows that the effects are similar to metformin. Maybe not quite as strong, not quite as direct, but really a good supplement overall. But really, really hits on really those pathways similar to metformin that helps with insulin sensitivity. And so berberine is the supplement of the week. You can kind of just really look it up and, can take it as indicated on the bottle, depending on which route you go. We have a great berberine supplement with that we provide on our website. Yep. So you guys can look at that. So that's support. Well, that's not the support.
GetWeightWise.com.
Yeah. So we have the two.
GetWeightWise.com.
But GetWeightWise.com has.
We'll put a link if we figure that out.
Yeah.
In the description.
But it's we have a good berberine one on there. I have several patients that have taken that one that really, really liked it, or still liking it, as just like, hey, kind of a more. I think that word natural gets used maybe a little too frequently in medicine, but yes, a kind of a more natural approach to doing similar to what metformin does without the prescription.
Yeah, awesome. Okay, and finally, last couple of minutes, let's talk about the skinny on science.
Yeah.
So I'm going to pull up. I was looking at, there was an article. This is just an article written by a provider who they kind of did their own little in-house study on multiple patients. They do telehealth visits. And what they wanted to compare is, the studies that were done on GLP-1s, on semaglutide, were done in a way that it was called the STEP trials. So they have well-defined dosing regimens. Okay, so I'm gonna close that for a second. So you follow that, and most prescribers, most providers will follow these dosing regimens. It's very set, and most of the time it's like, okay, your provider gives you a prescription, you're going to follow this schedule. You're going to take this dose for 4 weeks. You're going to up the dose to this for 4 weeks. You're going to up the dose, and you follow a very regimented plan. And your provider will see you in 6 months or a year, and that's fairly common practice. And that's kind of how those trials were done. What this guy did is they kind of personalized this a lot more, and they did follow up a little more than monthly. Like it was, I think, in 1 year they averaged 12.7 visits, and they adjusted the dosing of the medication much more individually and frequently. And so the results of this are that compared to, I think, 14.9% body weight loss in the actual STEP trials, in their clinic, the average weight loss was, I think, 21.8%.
Wow.
So like half again as much of your body weight lost by specifically adjusting the dosing of your GLP-1 medications with regular kind of monthly follow-up. And you talked about, the importance of accountability.
Yeah.
But just the dosing, making it more individualized, more specific, and they went slower with some people, faster with some people, and achieved remarkably more weight loss by doing that. So again, to me, that just emphasizes the importance of close contact, frequent contact, follow up with your medical provider who's providing these medications. It's not as much as it is not as effective to just get it on the internet and inject it according to the standard dosing schedule, because everybody's individual.
I agree. And the thing I'm hearing there is just that if you're going to go get these medications and you're just going to, like, more is not always better. I think the idea that as much as I can get, as much as high as I can go and tolerate and lose weight is not always better. We've seen this with our patients, but it's something we already knew, but it's nice to see that someone actually put it into a trial and essentially a study. And it's just really nice to see that the thing that we already knew, that not everyone requires a really high dose of GLP-1. Some people, the combination of a low dose GLP-1 and lifestyle changes is exactly what they need. And increasing their dose would only potentially increase their side effects with really no benefit.
Now, the counter to that is, actually I have another study I was looking at today that they went, or some people, they went as high as 3 times the recommended maximum dose of semaglutide. And some people tolerated that well and did much better on that. So I mean, it's just, it emphasizes again, the wide variety of effective dosing there is with these medications. And
I couldn't agree with that more. I see in clinic where I have had to move someone all the way up to these max doses and they're still not responding, and you're scratching your head. You're like, so I have someone on the same medication, same medication as another patient, similar size, similar build, similar age, similar medical history, and they're responding at the lowest dose. And then I have another patient that's at the max dose and they're like, can we go up? And like, usually the answer is no. Their reason they're doing these trials is because they've just found there's a certain amount of the population, and we don't know if it's receptor sites. We're not really sure if it's that they just don't have as much GLP-1, but they really don't respond to even the max dose of, let's say, Ozempic or semaglutide, or even Mounjaro. So they are looking at those trials now as a legitimate for some people that need to go up. But once again, if you're utilizing a medical provider to be able to walk you through this, you're going to be able to determine when it's best to maybe start looking at exceeding even the max dose as these trials give us more information. Because we're finding that these patients that end up getting put on these higher doses, at least everything that I've read so far, is that we're not increasing their side effect profile. They're doing great.
Yeah. Awesome. Okay. Well, get some berberine, talk to your medical provider. And we will see you next week. I think it's a good wrap up on some other options for people. Get some information out there in case that's going to be helpful. And we hope that makes you healthier ever after.
Take care.